early evening, good late evening, because in today's interconnected world, we are excited to gather virtually, transcending the borders and time zones to explore and advance the field of nephrocritical care together. Welcome to the first Nephrocritical Care Global Update. Now, as the agenda mentions that the introduction will be for 5 minutes by myself, but yes, I would like to take you for 5 minutes more to just take you through the journey of Nephrocritical Care Society in this short span of time, whatever we could do, and the vision and the mission I would be like to share with all of you. Today, we unite as a global community of healthcare professionals, researchers, educators, and advocates who share a common passion, improving the care and outcomes of critically ill patients with kidney-related conditions. This program marks a milestone for the Nephrocritical Care Society and for all of us. Throughout the event, you will hear from the experts. They are sharing the experiences and gain insights from diverse perspectives. Now, the agenda for today, as you can see from my screen, we would be having a very interesting, I can say, core controversial topics in nephrocritical care that would be challenging our existing understanding about the nephrocritical care. We would be also having journal scans. We will be also having finally the quiz for our young minds and smart brains. Now, the agenda for this program today, I could see is quite amazing, as we have, I would say, the world authorities in different fields, but they have all conglomerated together today to share their experiences from the nephrocritical care angle. So I would be introducing our panelist. With me, we have Associate Professor Dr. Hussein Al Rahma. He is the head of the department and also the organizing chairman of Emirates Critical Care Conference. He is the HOD Critical Care at Al Jahra Hospital, Dubai. With me also together, Dr. K.R. Ramanathan. He is one of our core founder member of Nephrocritical Care Society, and he is the director ICU Fellowship Program at NUS Singapore, associate professor at NUS, advisor National ECMO Standing Committee, Ministry of Health Singapore, trained and received FCICM from Brisbane, and a very active also member in Asia Pacific as well as in the international forum. Now, with me also, we have Dr. Valentine Lobo. He is very seasoned nephrologist and having very, you can say, significant impact on the nephrocritical care practice. He is a vivid teacher and he finds very interesting concept to show the, I would say, the path of nephrocritical care to his trainees. We have also Professor Dr. Pradeep Kumar Bhattacharya, sir. He is the Indian Society of Critical Care Medicine President-elect. He is the head of the department as well as the Trauma Center Director and also Dean Research at Rajendra Institute of Medical Science, Ranchi, India. With me also, I would say, a very young, dynamic Dr. Faten Farid, who has special interest in ECMO as well as the teaching to the young trainees through her own channel, YouTube channel. And she is the consultant intensivist at NHI Egypt. With myself, Dr. Sananta Das is here, and he is the, again, I would say, founder member and core member of Nephrocritical Care Society, trained in India as well as in Australia. Now he is the senior lecturer at Townsville University Hospital, Queensland, and he has real passion for nephrocritical care. I would be not wasting further time to introduce our extremely, I would say, talented and I would say the researchers, the educators for today's session. I would start with Dr. Prashant Nasa. He is my senior and he is right now the head of the department of NMC Specialty Hospital, Dubai, and very passionate about nephrocritical care. And also Dr. Niranjan Panigrahi. He is a very dear colleague, consultant intensivist at Apollo Hospital, Hyderabad, India. The rest of the two faculties, I would leave it to Dr. K.R. Ramanathan to introduce when Dr. Andrian Wong would be starting and followed by Dr. Pramod Guru. They are the, I would say, the authorities in nephrocritical care, and they would be having the first two plenary sessions for today's discussion. Now, if you would just move little bit further, I would say that the Nephrocritical Care Society is started, maybe I would say the early 2023 with the mission dedicated to advancing the field of nephrocritical care through three pillars: education, research, and collaboration. And the whole idea was to improve patient outcomes by promoting excellence in the care of critically ill patients with kidney-related conditions and fostering a supportive community of healthcare professionals at the global level. Now, the objectives with which the concept of nephrocritical care and then followed by the Nephrocritical Care Society was started was to promote education and training to enhance the knowledge and skill of the doctors, nurses, and paramedics related to nephrocritical care, to facilitate dissemination of best practices and evidence-based guidelines to improve the patient care. We also thought to support research and innovation with like-minded people to encourage research initiatives related to nephrocritical care, including clinical trials and outcome studies, and to foster collaboration among researchers, clinicians, and industry partners to advance the understanding and treatment of kidney-related critical illness. Definitely, there is advocate for the patient-centered care to promote interdisciplinary teamwork and communication. We are trying relentlessly to create a global network to establish connections and partnership with nephrology and critical care societies, organizations, and institutions worldwide. And that would definitely facilitate the exchange of knowledge, expertise among the nephrocritical care professionals on a global platform. And definitely, it's not only related to the clinical side. The idea is to enhance public awareness, and along with that, definitely the other healthcare providers apart from the nephrologist and intensivists. We are trying to provide a platform for the different collaborations, networking among the nephrologist, intensivist, nurses, and other allied professionals. The idea and all the attempts is to organize conferences, symposia, virtual events, and today is the one event that we are having to facilitate knowledge sharing and professional development among all the concerns. The whole concept is to ensure ethical and evidence-based practice, and that would definitely be our motto throughout our journey. The whole society and the members, they support professional development and also career development of professionals through different mentorship programs that is planned in future. There is also, along with the patient care, family engagement, and also the whole attempt is to also share the decision making and a patient-centered approach to the care. And we will regularly review and assess the society's activity and initiatives to ensure that they align with our mission and objectives. The brief history, just to start with, it was all a bright idea and some like-minded people. And the first Nephrocritical Care Conference, the concept conceptualized in Ranchi in early 2023, and the conference was a huge success, and that started the journey. And there were the international renowned speakers. You can see and there were many India and also nearby countries speakers who participated. They deciphered knowledge and tried to disseminate the concept of nephrocritical care. And the agenda was, you can see, the widely appreciated among all the colleagues and trainees who participated in 2 days conference cum workshop. There was also inauguration of Manual of Nephrocritical Care, which was written by myself as well as my colleague, Dr. Sananta. And you can see the topic. I just wanted to show to all the colleagues who have joined that nephrocritical care, the beginning of endless possibilities. And the last line I would say, the motto is together we think, together we plan, and together we flourish. Then came the April month when we had again another venture from Nephrocritical Care Society, that is the review course that was conducted in Mumbai, India on 21 and 22 April. And you can see the international faculties and the Indian as well as the nearby countries faculties. And this is the inauguration moment of the Manual of Nephrocritical Care by all the delegates as well as the faculties on the stage. And there I can share few of the glimpses of the event and the interest among the attendees you can see. And there was like interest to know the nitty-gritties of nephrocritical care from the experts. And it was attended by more than 100 trainees in the workshop review course. And there were like the ECMO workshops, there were like the plasmapheresis, RRT, all those hands-on and troubleshooting classes, master classes by the experts. Now, this is the website from Nephrocritical Care Society, though it is still in the infantile stage. But yes, we are trying our best to provide all the educational materials, the activities, the gallery, the contact details, everything, so that we can be updated with the recent advances in the nephrocritical care. Our global reach, now till now, we are affiliated and endorsed by Emirates Intensive Care Society, Egyptian Society of Intensive Care and Trauma, International Fluid Academy, World Society of Abdominal Compartment Syndrome, Egyptian Society of Intensive Care, and there are many other societies which are in pipeline to be affiliated and endorsed. We have a WhatsApp group dedicated only to academics, and there are 811 participants till today morning. Now, just moving further, the first nephrocritical care global update is the concept to provide a collaborative and informative space for all our researchers, professionals, educators, and advocates in the field of nephrocritical care. And we would be definitely having the learning, exchange of knowledge, and networking opportunity that would be beneficial to everyone.